help in relieving the symptoms as well. Eating 5 to 6 small meals works better for them than 3 large meals. And ultimately, they may need to have medication to get some relief and surgery to remedy the problem. Gastritis and ulcers are other problems that interfere with nutrition. Gastritis is inflammation of the stomach lining, and ulcers are actually a breakdown in the lining of the stomach. There are multiple causes for that, stress being a real big factor. Could be bacteria or viruses also are a cause for gastritis and ulcers, as well as overindulgence in alcoholic beverages. Symptoms of someone with gastritis or ulcers might be nausea and vomiting, abdominal pain, heartburn, gas or belching, and blood that appears in the vomit or in the stool. Treatment for this is a special medication. Person might be placed on a special diet, particularly a bland diet that might be more tolerated. Ultimately, they may need to have surgery as well. Visual impairments is another big problem why people may not eat adequately. It's more a problem with the elderly that have visual impairments or are blind due to glaucoma, cataracts, or macular degeneration. When dealing with people who have limited sight, it's important to tell them what they're eating and what's on their tray. Explain things to them, the position of the food on the tray. For example, your coffee is at the upper right corner of your tray and the milk is at the upper left corner. Describe the food on the plate in terms of a clock face. For example, your peas are at 4 o'clock and the chicken is at 8 o'clock. This helps patients be able to eat independently, and as much as someone can do for themselves, the better, as it does positively impact their feelings of self-confidence. Difficulty swallowing is another problem that interferes with nutrition. This is called dysphagia, the medical term for difficulty swallowing. It's not a disease, but it's a symptom of a condition that affects the swallowing process. Some of the common causes for dysphagia are diseases that affect the muscles and nerves. A couple of examples that come to mind are Parkinson's disease or multiple sclerosis. People with those two diseases tend to have some swallowing problems. People with respiratory problems or breathing problems, such as chronic obstructive lung disease, that are really struggling for air, may have an accompanying swallowing problem. And those that have dental problems is another common cause for swallowing problems. Foods that are particularly difficult for them to swallow are foods that are sticky. An example might be mashed potatoes. Foods that are thin, like water or juices, and dry foods such as crackers and toast cause people with swallowing problems particular concern. Warning signs that you want to watch for with these folks that there might be a swallowing problem would be coughing before, during, or after they're swallowing. The need to swallow repeatedly, sometimes 3 or 4 times with each spoonful of food. Frequent throat clearing is another indication that there might be a problem with swallowing. A hoarse, wet, or gurgly breathing. Drooling from the mouth when they're eating. And pocketing of food in the mouth is another warning sign of swallowing problems. Aspiration is the medical term that means taking food, fluid, or mucus into the lungs. This happens when patients swallow these items and it goes into the lungs rather than into the stomach. It's a very serious health problem because it can cause pneumonia or other respiratory problems. When you think that the lung tissue is only to have air in it, that when food or fluid get into it, it's going to set up a situation where there is inflammation and infection that's caused as a result of it. Interventions that will help prevent aspiration is the need for a nutrition support team. This nutrition support team is comprised of a physician, a nurse, a dietitian, and a speech pathologist. And they develop a plan, and this plan helps the patient so that the swallowing problem is minimized. There are special instructions then that are posted either above the patient's bed or in a binder for everyone's use. It's also important to use something that's called a food thickener. Food thickeners are needed to make very watery liquids a little bit more solid. I have an example of a product here that's used for thickening liquids. This particular product is called Thicket, and I want you to see what happens when I just add a teaspoon of this Thicket to this orange juice. By stirring it briskly, you may be able to note that it's getting thicker, and it changes the consistency from a very liquid orange juice to something that is more of a nectar consistency. There are 3 different kinds of consistencies that people will, that this nutrition support team will work for. The instructions might be that it should be of a nectar consistency, and that's a little bit thicker than water, for example. I'll pour a little bit of this nectar, and you may be able to tell it's a little bit thicker than water. It's more like a vegetable juice might be. Another consistency of the liquids that might be prescribed in the instructions would be of honey consistency. And as I pour honey, you can see this is even a little bit thicker than that nectar consistency.